One of the most common problems with shoulder dysfunction or shoulder pain is a loss of the motor pattern that produces powerful movements through the shoulder. So as you rotate to throw a punch or anything that involves rotation through the upper back, you initiate with a rotation of that mid-back, where your ribs are, your thoracic spine. Power should be generated through there. The amount of force that I can generate pushing my mid-back like this is far greater than any sort of force that I can push by moving my shoulder like this. So we're going to try to groove this pattern by working on that roll of that T-spine. So we're generating power through the roll of the T-spine, having that scapula nice and stable, and then giving us free adjustment movement through the glenoid or the GH joint, which is your true shoulder joint, where the rotator cuff goes around the head of that humerus right at your shoulder. So we're going to do the first part of a Turkish get-up to really start grooving that rotation of that thoracic spine. You're going to start by holding the kettlebell kind of right in front of you and bringing it nice and close to your body. This is going to help you get it to the center of your chest so we can get up to the position that we want. You're going to roll over, get it to the center of our chest like so. Once we're in this position, you can keep your far leg straight and then bend that leg that's on the side of the arm that we're going to work. You're going to press that kettlebell up and then bring that arm down and over in about a 45-degree angle. As you produce this movement, you want to make sure that you're not doing a crunch, that you're feeling like this shoulder is well down on the ground and you're doing a rotational movement as you push that arm up. You're going to fully first push out that scapula and then rotate all the way around and then come back down. Roll that scapula forward, roll that T-spine forward, back, and back down. You're going to feel some pinching, some mobility movements, and some uncoordination through some of those insertion points, maybe even all the way around to your back. Particularly if you're suffering from shoulder pain, you're going to not be used to turning those muscles through your core on properly. The first few reps, you probably feel the most. As you get through it, up to like 9 or 10 reps, you'll feel it less and less. Give it a try. We're trying to work that powerful rotation through the T-spine with a stable scap so we can have freedom of movement right at your true shoulder joint, stop impinging those rotator cuff muscles.